Our next H word is hip pain, and Brett in Albuquerque, New Mexico wrote us a recent email about it. I'm a 40-year-old runner, and lately when I run, there's a sharp pain on the outside of my hip that continues long after I finish my run. Does this mean I'm going to need a hip replacement eventually? We invited orthopedic surgeon Dr. Paul Gilbert here to help answer Brett's question. Thanks for being on the show.
Pleasure to be here. Thank you.
And of course, we're not going to formally diagnose someone based on email alone, but there's some concerns. Well, am I going to need a hip replacement? You don't think, based upon those symptoms, that's probably what's going on?
No, fortunately for Brett, a 40-year-old runner doesn't necessarily mean he's going to have arthritis in his hip and need a hip replacement. More likely, he's got something going on the lateral side or the outside of his hip that's called bursitis.
So what we're looking at here are bursa, which are outside the hip. I want to make that very clear, not in the hip joint. Tell us what these do and what may be happening in the case of Brett.
No, it's not in the hip joint at all. A bursa is a fluid-filled bag. It's like a flat water balloon. And what it's meant to do is allow one structure to roll by another without rubbing. So you have them in your knee, your shoulder. Everybody's heard about bursitis. And in the hip, it's on the outside of the bone here, your most prominent part. Now, the issue comes because there is a muscle tendon unit that comes all the way from your pelvis down to your knee called the iliotibial band. And that band can be tight and goes across that bony prominence, which happens with runners, walkers, people that sleep on their side. That kind of pressure, that kind of repetitive action can irritate the bursa or make it raw, and that's what gives you that sharp pain.
So what is someone to do then? If they're having problems, they're concerned that it could be bursitis, what to do?
Well, the first thing is to try and identify what the cause is. If you're a runner, you might want to back off on your running. If you're a walker, you might want to back off on your walking. And if you sleep on your side and that's your cause, you might want to check your mattress. An old mattress, a soft mattress, a really firm mattress, which a lot of people use because of a bad back. If they change their mattress and use a softer surface, it may put less pressure across their hip. Another key point is heat. Just like a baseball player going into a game, to warm up his hip and stretch it. So stretch out that band, iliotibial band, so it's not putting pressure across that bony prominence. It can relieve some of the tension, relieve some of the pressure on that bursa. You can put ice on your hip as well, but usually when you're done all your activities. Now, what a doctor can do to help is prescribe anti-inflammatories or give a cortisone shot. A cortisone shot into that area can break up the bursa, relieve the pressure in the bursa, and the cortisone acts as a strong anti-inflammatory to decrease some of the inflammation. And if your hip bursitis is recalcitrant, it's not responding to any of these treatments, you can have surgery. And the surgery is done through either a small incision, or we can use the tools we use for arthroscopy to go in and actually, with this cautery device, vaporize away the bursa, so you eliminate the bursa. And the body is so amazing that it'll create a new one. It's kind of like starting over. And the second part of that procedure is you can actually pie crust or poke holes in that band to allow it to stretch without rupturing it completely. So surgery can be helpful if everything else fails.
But last resort, Dr. Gilbert, thank you so much for joining us. We really
appreciate it. All right, my pleasure.